The interesting thing is that, well, so different people respond to data differently, right? So some people, right, knowing that they're an ApoE4 heterozygote or homozygote, that may be the thing that then leads them to change other health behaviors because they know it's going to have an effect in those individuals. Great. In others, there have been studies where they've given people or told people their ApoE status, and around at least a quarter of them said, "I wish I never knew," because all it's done is it's made me stress about dementia, and I don't think I could do anything about it.
Yep. There's a lot of good companies that are innovating in this area. I know Absolute Rest is one of them. I
Mm.
refer a lot of people to Rest Assured, which I know you can have them use a Whisper device that not only
Yeah,
shows you your REM sleep, it also shows you your deep sleep. And I believe that's validated against a polysomnogram. Even though it's a home study, they just ship it to
yeah,
you. And I think the max price, again, it could be wrong, is like 300 something dollars. So I would much rather have that, because so many people ask you, I wanna test my risk for getting dementia. I wanna test my cognitive health fitness. And it sounds like a better way of doing it is getting your VO2 max, tracking that. And the good thing about that is you can actually improve your VO2 max and your body
yeah.
composition on your DEXA scan data, and you can improve your sleep data where you can't really change your ApoE genotype. And you can't, if you're probably the worst is if you're just Googling dementia quiz and you take a quiz and it tells you have Alzheimer's and you need this really expensive treatment.
Yeah. The interesting thing is that, well, so different people respond to data differently, right? So some people, right, knowing that they're an ApoE4 heterozygote or homozygote, that may be the thing that then leads them to change other health behaviors because they know it's going to have an effect in those individuals. Great. In others, there have been studies where they've given people or told people their ApoE status, and around at least a quarter of them said, "I wish I never knew," because all it's done is it's made me stress about dementia, and I don't think I could do anything about it. So you can, like, with some of these tests, you can make things worse depending on how the individual is going to respond to those data.
Yeah, that's an important thing to keep in mind for example, screening for cancer genes or
Yeah.
cardiovascular risk genes, really any genetic test. And that's also why I'm a relatively firm advocate. I reserve the possibility of changing my mind with anything when new data comes out and I learn more. But as far as like the self-service labs or self-service MRI, whatever, I
Yeah.
think chatting with a clinician about the risks and benefits of testing before getting, screening or preventive or longevity MRIs or CAT scans, CCTAs, any genetic test is
Yeah.
pretty reasonable. Um,
100%. Yeah.
yeah. So I guess some takeaways there is you can track all this data. You can also track your diet. You can also track your labs. The one thing that I guess we haven't touched on as much as far as like screening or prevention is if there is a uh, like the benefit of going to these clinics that are called longevity clinics, because I suppose mine is somewhat considered this. But it's longevity clinics are almost kind of getting in that vein of functional medicine clinics where it's becoming a
Mm.
bit of an anathema to say, where you don't
Yeah.
really want to be associated. Um, what's your outlook on like the trend with that?
Yeah. It's really tricky because we know, right? I don't work clinically anymore, but I'm a trained physician, and we know that most physicians aren't that well trained in prevention, right? Whatever it might be, you preventing, be that preventing dementia, preventing early mortality. So I think a focus on prevention and getting that to as many people as possible is incredibly important, right? I'm very, very passionate about that. However, I think most of the things that people need to do for prevention are fairly simple and admittedly not particularly interesting, right?
Yeah.
We know we need to sleep more, eat better, right? Physical activity, social connection, all that kind of stuff.
Same thing for
Um,
natural hormone optimization.
yeah, it's funny how that works, right?
Yeah.
So then, right, do you need to be a physician to do that? You maybe just need a good health coach, but some good diagnostic labs and things along the way, great. And sometimes, right, we've already talked about some potential. Right, if you have types of diabetes, I think you should take
Yep.
metformin. If you have very high cardiovascular disease risk, I think right, you should think about lipid lowering.
Yep.
So so that stuff becomes important as well. But having interacted with lots of quote unquote longevity physicians, like it's gotten to a point where it's all whole genome tests and like more peptides than that you can shake a stick at,
Yep.
and IV methylene blue, and all this other stuff that we just do not have good data for, and the risk benefit ratio just isn't understood enough to be giving this to people,
Yep.
especially under the headline of longevity.
Yep.
So I'm a big fan of this idea, but some of the implementation does worry me a little bit.
Yeah, I strongly agree. One other way that I look at it is, um, when it comes to medicine, it's kind of like digging. You can always dig deeper, and the reason why most algorithms or evidence-based medicine does not dig deeper is you do damage if you dig deep enough.
Yeah,
When you get into those genetic tests or finding incidentalomas on which are incidental findings on imaging, but for the right patient, after a long process of physician-patient rapport and shared decision making, understanding those risks, they're okay for some patients, but
yeah,
definitely not as a cookie cutter regimen that you give to every single person. Um, but yeah, a good rule of thumb is the biggest help, like you said, is just digging a little bit. So if you go outside
yeah,
and you dig a 3 or 4 foot ditch with a shovel, that's probably fine. But if you're digging in a dangerous location, you probably want to check for wires and utilities first. And if you're
yeah.
going to dig a massive hole, that's probably just going to become a sinkhole. And you should do it with the help of a physician. But I agree 100%.